Assalamu alaikum viewers, welcome back. This is Dr. Abid Sargani. Viewers, in our previous lectures we were discussing about the various systematic disorders commonly found in dog and cat. So in today's lecture we are going to discuss about the skin or integumentary disorders commonly found in dog and cat. First of all, I should clear that these disorders are very much important from the clinical point of view and for your just knowledge. So let's discuss that what are the common skin disorders found in dog and cat. First, pyoderma. Clinical cases reported here comes under that our cat is suffering from the pyoderma. Pyoderma refers to the pus accumulation or pus peeping from the skin. It may be caused due to the infections with Staphylococcus pseudointermedius. But this is not the only cause of the pyoderma because this may be the secondary to the other skin disorders, hormonal or immune disorders, or any of the infections like fungal or viral infections or mites and ticks around the skin. So this is the secondary condition or sign of the disease. So second one is Malassezia pachydermatis. I should clear that Malassezia pachydermatis is a yeast or fungus which causes the lips, interdigital skin and mucus and external ear canal scrapings or scabies. So these are the most preferred or predilected sites for the Malassezia pachydermatis infestation. And third one is demodicosis. Demodicosis is a very much dangerous disorder which occurs due to the mites commonly in young age in dogs. It is caused by Demodex canis in dogs while Demodex cati species of the mites in the felines. So in demodicosis, what does it causes? In demodicosis there will be dehydration and all over the skin are generalized scabies of the body, especially around the faces or bilateral areas of the faces are affected and other body parts may also be included. These may be generalized or localized. So let us have a deep look over the demodicosis in detail. But I should clear that skin disorders are not limited to just these, but this is the just overview or most common diseases we are discussing. So I have mentioned these three and in detail we will discuss further also. So how you will diagnose the demodicosis? Demodicosis in dogs is characterized by alopecia. Alopecia refers to loss of the hairs and comedones. Follicular costis, papules and pustules may develop later in the stage of demodicosis. While in more severely affected dogs, crusting with secondary bacterial infections and systematic signs may develop which leads to the pruritus or secondary bacterial infection causes the pyoderma. Demodex injai is a species of the mites which occurs more often in terrier dog breeds and additionally causes excessive greasiness due to the excessive production of the sebum from the sebaceous glands in the skin. While in cats, Demodicus cati shows similar clinical signs, whereas by contrast, infestations with contagious Demodex gatoi often lead to truncal pruritus. There are several species of the mites which are responsible for the demodicosis in dog and cats, but I have mentioned here a few of greater importance. Let's have a look on the photographs or the clinical conditions developed in the demodicosis. Here in the picture you can see the pustular demodicosis on the ventrum are the belly of a dog with generalized demodicosis. Generalized demodicosis means that whole of the surface of the body indicates the condition of alopecia and papules or pustules, and there may be scabies as well. Severe facial demodicosis in a dog. Here you can see this is the demodicosis which develops and causes the further rashes also. Comedones in the perivalvular area of a dog with demodicosis are also common. Here you can see pododemodicosis. Podo refers to foot and demodicosis is a condition in a 1-year-old male neutral pug with generalized demodicosis. Pug is a breed of a dog. So here comes the diagnosis, the main part of the clinic. For the diagnosis or the conformity diagnosis of the demodicosis, we refer deep skin scraping test. Currently the diagnostic method of choice is deep skin scrapings. And then trichograms, trape strips and examinations of the exudate may be useful in identifying the Demodex mites. More than one mite on any given test is an indication of clinically relevant demodicosis. For the treatment purpose, treatment for the generalized demodicosis should be monitored clinically and microscopically even month until the second negative scraping. So here you cannot take it easy, so you should consult to the veterinarian for the diagnosis and proper treatment of the demodicosis. Either it may be lethal to the pet. For the treatment, it means that those drugs which kills the mites, therapy should be continued 4 weeks beyond the second set of negative monthly scrapings to decrease the risk. So this is just for your knowledge, and for the further details or the diagnosis and treatment, you should consult to the veterinarian. Thank you very much. If you are new here, then I would like to request you to subscribe my YouTube channel and please share. Thank you very much.